training. Welcome everyone to our Next Generation NCLEX 7-day training, and today we are going to be covering this live training day 5. So we have covered many important details, strategies, and questions that you cannot miss. So if for whatever reason you missed day 1, day 2, day 3, or day 4, go back and see those days that we provided that training. So who is this training for? Anybody preparing to pass the NCLEX, whether it is now or starting on April 1st, 2023. But this training specifically is going to be about Next Generation NCLEX. However, if you're taking the NCLEX within the next few weeks, make sure you also see this training, because I will be talking about critical thinking, prioritization, and so on. So day 1, we gave an introduction to the Next Generation NCLEX. We covered our first case study. Day 2, we covered strategies, multiple response select or apply questions. Day 3, we covered all the strategies, and we discussed the multiple choice single response and the matrix multiple choice items on the Next Generation NCLEX. Yesterday, we covered multiple response grouping items and matrix multiple response items. And today, we are going to cover a very interesting style of question known as the bow tie items. Bow tie Next Generation NCLEX style questions. The questions we will be discussing today, they're going to be very interesting for you. I hope that you came with your critical thinking activated, because the questions we will cover today, they're very difficult. So let's see how you do in this live training. As always, at the end of the presentation, we will give free access to several nurses here that have subscribed to the raffle. We're going to be selecting 3 nurses at the end of tonight's training. And I want to give thanks to Jill Marie Archibald. She is a registered nurse with NCLEX Crusade, and yesterday she was the person in charge of donating 10 memberships for the nurses that we selected in yesterday's training. So anybody that I mentioned their name yesterday, this is the person you want to thank, is Jill Marie Archibald. Thank you, Jill Marie, for your kind heart and wanting to help nurses out there. If you don't know how to register for the raffle, all you have to do is visit this website. I've put the website in the description area, in the comment section as well here in the live training. And all you have to do is fill out the information. If you're here new to our training, welcome. Make sure you are subscribed to our channel, activate the bell, and of course, like always, like this video so you can help the academy grow and help other nurses out there that don't know our trainings and how beneficial they are for their success. So for the past few days, we've been talking about different strategies on how to recognize cues, analyze cues, prioritize hypotheses, and today we're gonna put everything together. We're gonna put everything together we have discussed in day 1, day 2, day 3, and day 4. So this is why, starting from now, all the trainings, all the live trainings, starting from now until Sunday 5 p.m., they're gonna be critical for your success. So don't miss any of the training. So let's put everything together. But before that, let's discuss what generating solutions mean on the NCLEX. When generating solution, the nurse uses knowledge of treatments, interventions that will address identified client needs and modifies them to provide priority care. The nurse needs to be able to generate the best possible evidence-based solution to provide care. What does this mean, Professor? After you have analyzed the case study or the clinical scenario, you have to identify which nursing intervention help with the problem you have identified as the most important or relevant problem on the stem of the question. So how do you know that you need to generate solution? Well, as you face an NCLEX style question, you're going to see questions that ask you to prioritize, and then you have to identify, well, which nursing intervention will be the most appropriate for that specific scenario. Always ask yourself this question: what are the desirable outcomes for this client? In other words, what do I want to accomplish? What can I do to help the patient with that specific problem? Another question that you can ask is, what interventions will achieve those outcomes? For example, let's say your patient has difficulty breathing. So you got to say, well, what is the desirable outcome? What do I want? I want the patient to breathe normally, to have an adequate gas exchange. Well, what interventions will achieve that? What can I do that will help the patient get there? Provide oxygen, provide a bronchodilator, depending on what the situation is. And a third question that you can ask is, what interventions need to be avoided that could make the problem worse? Why? Because when you see NCLEX question, they're going to put answers that are distractors, that if you select them, instead of helping the patient, what you're actually doing is hurting the patient even more. So how do you generate solutions on a next generation NCLEX clinical situation? Let's take it one step at a time. And we are kind of like summarizing what we have been discussing so far. You know, the best and most important action to take with a clinical scenario is to identify the 5 key factors of an NCLEX style question. If you don't know what that is, find it here in our YouTube channel. Recognize those keywords or cues that are important and or relevant. Once you have developed these keywords, you have to analyze it. What do they mean? Do you have a scenario that it is stable or unstable, expected or unexpected? What does the data provided tells you? If you have subjective data, what does it tell you? If you have objective or measurable data, what is it telling you? And then you're going to start identifying which priority action you can take with those patients to help in those specific conditions. So this is a way of putting everything together. Now, what type of questions or which type of NGN items will measure generate solution strategy? Any question that deals with drop down clause, drop down rationale, drop down in a table, also multiple response select N, multiple response SATA, and multiple response grouping question. And also drag and drop clause, drag and drop rationale, and drag and drop in a table. In today's training, the first type of question that we will be discussing is the drag and drop clause. So let's begin some critical thinking. So now I want you to start analyzing these questions and identify the key factors. Remember everything we have mentioned: recognizing cues, what is important, what are the cues telling you, generate a hypothesis, what do you think is the problem, and what are possible interventions that could be taken to help that patient specifically. So the scenario is the following, okay? And I want you to make some notes about the information, because I cannot put all the scenario and the table together in a PowerPoint presentation because I have a very limited or small space. So try to make some notes so you can remember what the scenario is about. That way you can answer the question when I put it on the next slide. So at 1400 hours at 2 p.m., you receive a patient. Let's identify some keywords or relevant information in this scenario. Now, what you want to do is, I want you to see if the information that you're selecting as important or relevant is the same information I am selecting as important or relevant. Because this is a way for you to prove yourself that you're doing better. So definitely the 32-year-old information, my patient's age, is important. Has a history of uncomplicated mitral valve stenosis. Anytime they tell us about a history, it's important to note it. Mitral valve stenosis that is currently being monitored. The client delivers a 7-pound 4 ounces baby. So we have a delivery via an uncomplicated vaginal delivery. So there was no complication during the delivery. That is important. The client is breastfeeding the baby. Super important. Breastfeeding after the delivery. We're going to see why. Then 1 hour later, at 1500 hours, at 3 p.m., the client's spouse calls the nurse because the client is complaining of abdominal cramping and complains that the peripad feels wet. We have a change in condition from 2 p.m. to 3 p.m. We have a change in condition from 1400 hours to 1500 hours. What is the change in condition? Well, we have abdominal cramping and peripad feels wet. So we have some bleeding possibly here. So we continue reading. They are providing in this scenario the vital signs. And they're also providing an assessment that the nurse conducted. What did the nurse do? The nurse went to check on the patient and found out that the peripad was saturated with blood. So this is confirmation that there is some bleeding going on. Vital signs: heart rate 120, tachycardia, BP 98/62, borderline hypotension, respiratory rate 24, SpO2 92 on room air. So all these vital signs are important. Now they're giving you information about the fundus. Remember that we are in the postpartum period. So any information about the uterus, the fundus, is important. The fundus is soft and 4 finger breadth above the umbilicus, and here's the key word, deviated to the right. So we have fundus is soft and deviated to the right. So based on this information, now we're gonna do a drag and drop clause style of question. And it looks like this. Based on this scenario, what is an appropriate intervention to do? It says, to meet the client's need, the nurse would immediately plan for option 1 and option 2. So you have to select an answer from the options provided in option 1, and you have to select an answer in the answers provided in option 2. Now, here's the key. You can only select one answer from each side of the table. Remember that there is a keyword here that is immediately tells you that this is a prioritization question. So what would you do as a priority nursing intervention in a patient that is bleeding, that has saturated the peripad, is borderline hypotensive, with tachycardia, and the fundus is soft and deviated? So what would be an appropriate intervention? So let's select one for option 1. What do you think is the answer? Comment your answer in the comment section. Are you going to do a uterine massage? Are you going to do a rapid administration of blood? Are you going to do administration of this medication? Or are you going to do a manual exploration of the uterine cavity? So if we're thinking of prioritization here, we have to think, what is an appropriate nursing intervention that will help me stop the problem or will help the patient's problem? We can also see, are there any answers that are outside of the scope of practice of a registered nurse? Do I see any answers that are inappropriate? So I can use the process of elimination. Just because the answers are on a table, that doesn't mean that I cannot use the process of elimination. So, answer number 1, uterine massage. Will that help with this possible uterine atony? Would it help with that bleeding to massage the uterus and help the patient with the bleeding? So, answer number 1 is a possible answer. Answer number 2, rapid administration of blood. Well, there's no indication in the clinical scenario that the hemoglobin was checked. There's no information about blood typing. So there's no need for doing a rapid administration of blood. So this one we can eliminate. Answer number 3, this medication. Wow, this is very important. A little bit advanced on pharmacology, but this medication is actually contraindicated in patients that have heart problems. And remember, the beginning of the question gave you a history that stated that the patient has a cardiac history. Therefore, this medication is contraindicated. So therefore, I will eliminate this answer as well. And the manual exploration of the uterine cavity, this is outside my scope of practice. That will be something that the doctor would do if the uterine massage doesn't help with the bleeding. So I can eliminate the last answer. My correct answer would be uterine massage. So we have one side of this question completed. On the side of option 2, I have to select between hysterectomy, uterine tamponade, oxygen administration, and IV infusion of oxytocin. So if you look at this, we're looking for plan that can be done by the nurse because we're dealing with a priority question. So which one of these answers in option 2 can the nurse do? Well, we have oxygen administration, the nurse can do that, and IV infusion of oxytocin, the nurse can do that. So we can eliminate the hysterectomy and the uterine tamponade. Now, in between oxygen administration and IV infusion of oxytocin, what is the correct answer? And you may think, well, if I use Maslow here, oxygen will be the priority. Oh, but be careful. you have to go back to the scenario. Let me show you the scenario again. Let's go back to the scenario. What was the patient's O2 saturation? 92. Although it's on the low range, it's still within normal range. And also, the respiratory rate of 24 is normal because the patient is in pain. Remember, the spouse called reporting that the patient had abdominal cramping. So it's normal for the respiratory rate to be a little bit elevated, and the O2 saturation does not indicate hypoxemia. So yes, oxygen administration is a priority according to Maslow, but it's not the priority in this situation, because the problem here is not oxygen. The problem here is bleeding. So the correct answer will be IV infusion of oxytocin, not the administration of oxygen. You see the importance of really understanding the clinical scenario? Because if you are expecting to answer these type of questions, the prioritization style of questions in this new NCLEX, that will be harder just by saying, I know ABC, that is enough? Not enough. Not enough. You have to use your clinical judgment. You really have to go back and forward to the case study or the clinical scenario and identify what are the keywords and why are they giving you the information that they're giving you. So let's go to the next style of question that I want to specify in today's training. The bow tie style of questions are very difficult questions. I'm not going to lie to you. I'm not going to say, don't worry, this is easy. No. These type of questions are difficult, and you really have to master clinical judgment. Now, before we go into this new style of question, how do you do on the previous question? The total points was 2. How many points did you get? 2 out of 2, 1 out of 2, or 0 out of 2? Let me know in the comment section. I see some 2 out of 2, some 1 out of 2. Okay, nobody 0 out of 2. Oh, 1 out of 2 and 2 out of 2. Okay, perfect. All right, so the bow tie items, they will provide a clinical scenario, and they will include usually a lot of information. In today's scenario, I will make it a little bit more simple to you, and I'm not going to give you a big case study, okay? Because I want you to get the idea and become familiarized with this type of question, okay? All right, so perfect. We got 448 live today, 206 likes. Thank you. Thank you for everyone that's been liking this video. If you haven't done it yet, click that like button and share this video with other nurses out there. As you're analyzing a bow tie question, you're gonna go through each of the 6 steps of the Next Generation NCLEX clinical judgment model, which is recognizing cues, check, we have already covered that. Analyzing cues, check, we already covered that, you know how to do that. Prioritizing hypotheses, check, we already know how to do that. And generate solutions, check, that's what we are covering today. Now, in order to answer these questions correctly, you have to know the take action and evaluate outcomes side of the formula. We are not there yet. We will be covering them in day 6 and day 7. But today's question, I think you can manage to answer them without this information that we have not covered yet. So this is the scenario. At 3:30 p.m., 15:30 hours, a client is admitted to the emergency department with the partner, and reports feeling extra tired. Okay, this has been going for about a week. Right now, this does not provide any important or relevant information. It's something that has been going on for a while, and now it gets interesting. Notice the change in the scenario. The patient has been experiencing intermittent chest pain and dyspnea when? Today. So notice the time frame change. For a week, probably not as important. Today, this is what was new. What's new? Chest pain and dyspnea. The question you have to ask yourself is this: why is my patient coming to the ER with chest pain and dyspnea? Let's keep reading. The patient had a right ankle ORIF, which is an open reduction and internal fixation. It's an orthopedic surgery. 10 days ago. You have to ask, is there any relationship with this surgery of the right ankle 10 days ago and chest pain and dyspnea? What's the relationship? If, as I'm saying this, you start thinking of a relationship, you're starting to formulate that hypothesis. Let me know in the comment section what comes to your mind. What comes to your mind with the relationship between a orthopedic surgery and chest pain and dyspnea? Comment in the comment section. It says other history includes several recent anginal episodes, diabetes mellitus type 1, and GERD, gastroesophageal reflux disease. Says the admission blood glucose is 159, so it's a little bit high, little bit over the expected range. And now we're gonna do the bow tie. What is a bow tie? Why does he have the name bow tie? Well, it looks like a bow tie. It looks like a butterfly. So that's why he has that name. It looks like a bow tie. And then the most important thing with a bow tie question is that you have to do 5 things. Let me see. 5 things. Yes. You have to do 1, identify what the possible medical condition is, what action you're going to take based on that possible medical condition, and which parameters will you monitor in that patient. So let's say you thought of pulmonary embolism. So that is a condition that you're thinking of. Write it down in your paper. Whatever condition comes to your mind, write it down. Because when I put the question, you may see your answer there. You may not. It depends. So based on this scenario, chest pain, dyspnea, and the surgery, which condition is the patient most likely experiencing? And then you have 4 options: pulmonary embolism, upper GI bleeding, unstable angina, and diabetes ketoacidosis, DKA. Some of you thought of other answers that are not even here, so don't worry about it. If you thought of something that is not here, it was incorrect. But I saw that many of you thought of a pulmonary embolism. So we have to eliminate, right? If you're thinking of PE, why not upper GI bleeding? Why not unstable angina? Why not DKA? Well, the first one that is super easy to eliminate here is DKA. Why? Well, what was the patient's blood glucose level? It was 159. It was slightly over the normal range. We know that diabetes ketoacidosis the patient present with very high glycemia, very high blood glucose levels. So DKA does not make sense. Could it be unstable angina? What do you think about that? Did that answer went through your thought process? Unstable angina. Why or why not? What do you think about that answer? Let me know in the comment section. What was the history in the patient? It said several recent angina episodes. It wasn't telling you unstable angina episode. And it doesn't manifest with the clinical manifestation that they're giving you in the scenario. So unstable angina doesn't make doesn't make much sense. Upper GI bleeding, there's no really information on the stem of the question that talks about GI bleeding. What was the main problem? Chest pain and dyspnea. So we have some respiratory problem there, some respiratory compromise. So the one that makes the most sense is P, pulmonary embolism, that relates specifically to the post-surgery because the patient had an orthopedic surgery. So PE is the correct answer. So this is how you do this type of question. You first start with the diagnosis or the patient's condition. Okay? That's the first step. Then you think, all right, I have the pulmonary embolism established. That is the problem I will be picking. What nursing action am I going to do for the pulmonary embolism? See, this is the problem. In the answers, in the nursing actions, there's mixtures of things that apply to PE, things that apply to upper GI bleeding, and things that apply to DKA. So that's why the most important thing to do is starting with the diagnosis or medical condition. So I have a P. Which nursing action is priority in a pulmonary embolism? Start continuous IV heparin infusion. Well, that makes sense. That makes total sense. So answer number one, I like that answer. Giving IV regular insulin. That answer doesn't make sense. That will be appropriate if a patient was in DKA, but it's not appropriate for pulmonary embolism. And you may think, well, but the blood glucose was a little high. Well, even with that slight level of blood glucose, if anything, you might give subcutaneous insulin, not regular IV insulin. That doesn't make sense. And most of the sliding scales, you don't even give insulin until it's like 200 or above in most sliding scales. But let's say that you're thinking of insulin because of the high blood glucose, it would not be regular insulin. So answer number two on the nursing action doesn't make sense. Inserting an NG tube, that doesn't make sense for PE. So I'm going to take that one out. administer oxygen at 4 liters via nasal cannula. Well, that makes sense. Remember that the patient came to the ER with chest pain and dyspnea. So administering oxygen makes sense. And administering sublingual nitroglycerin, that doesn't make sense for P, so I'm going to take that one out. Okay, so now we're going to go to the right side of the bow tie. We already know the diagnosis or medical condition. We know the nursing actions that are priority or appropriate. Now we're going to think, well, if I have a patient with a PE that I started on continuous IV heparin infusion and has oxygen at 4 liters, which parameters do I need to monitor? So on the right side, based on this condition and these nursing actions, what makes sense? And you have to eliminate. For example, POC, the blood glucose level, the AccuCheck. Well, remember that the patient's blood glucose was a little bit high. So we had a 159 blood glucose level. Do I need to continue checking the patient's blood glucose? Yes. But is it the priority? Is it the most important parameter to monitor in PE receiving heparin and oxygen? No. So the first one I will eliminate. How about oxygen saturation? Well, that makes sense. If I am administering oxygen to a patient that had dyspnea, monitoring the oxygen is an important parameter to monitor. How about pain level? Well, that's important. Remember the patient? Chest pain? Do I need to monitor the pain level? Yes. But is it the most important thing to monitor in a patient with PE receiving IV heparin infusion? No. If we use Maslow, pain will be psychosocial. Oxygen is physiological. So that is important. Psychosocial for pain, because you know that pain is psychosocial for the NCLEX. If you don't know that, go back to the first training that I did. So I can eliminate pain. Vital signs, also physiological, important. It would give me everything: heart rate, blood pressure, and all the rest of the vitals. So that would be an appropriate parameter to monitor. And serum creatinine doesn't make really much sense here, so I can eliminate that one. So my final answer will be PE, heparin, oxygen, O2 saturation, and vital signs. There is a total of 5 points here. How many of you got 5 out of 5, 4 out of 5, 3 out of 5, 2 out of 5, or 1 out of 5? Maybe you got 1 correct. So let me know how you did in the comment section. All right, we're almost there. 300 likes. Let's get to 477. Do you want to see another question? Do you want to practice another awesome question? Another bow tie question? Come on. Hit the like button. Help me out here. Okay? I see a lot of 5 out of 5. Good job. 4 out of 5. Awesome. I see vital signs include saturation. Correct, but it's the only question left that makes sense. And you need to have 2 nursing actions and 2 parameters to monitor. So if you already picked vital signs, the other thing that makes sense and has the priority is O2 saturation. Okay? All right. What do you think about this style of question? The bow tie. Do you like it? How do you see it? Medium hard? Not too hard? Very hard? What's your opinion on this? What do you think? Let's go to the next scenario. This is a little bit longer scenario, okay? I see, not easy. I love it. Is it considered all wrong if I put one wrong? Nope, you get partial credit. You get points for the ones that you did right. Medium hard? Hard? Very hard. Okay. All right, let's go to the next question. So now the scenario is a 53-year-old client undergoes a right lung wedge resection to remove a tumor. The tumor has caused moderate to severe pain in the right lung area. The medical history includes hyperlipidemia and taking ortovastatin 40 milligrams daily. At 11 o'clock, the client was admitted to the medical surgical unit from the recovery unit after the surgery. The patient has a chest tube, so this is very important here. We're getting to the important part. The patient has a chest tube, 3-chamber closed chest tube drainage. There is a insertion site of the occlusive. Dressing is dry and intact. Well, that's very good. 50 ml of bloody drainage. That is normal and expected. There is intermittent bubbling in the water seal chamber. Okay, that is important. Gentle bubbling in the suction control chamber. That is important. Patient is arousable, oriented, receiving oxygen via nasal cannula. Head is elevated. The temperature is normal. Heart rate is normal. Respiratory rate on the high range, but normal. BP is normal. O2 saturation is normal. Not too bad for the pain, 3 out of 10. It increases with deep breathing and coughing, that is expected. Now here comes the change. At 12 o'clock, the nurse notes that the client has dyspnea and reports increased pain. So it went from 3 to 5, and now the patient reports difficulty breathing, dyspnea. The nurse looks at the collection control chamber, is at 100 ml. There is continuous, vigorous bubbling in the water seal chamber. This is extremely important. What does continuous, vigorous bubbling in the water seal chamber indicate? So now when I put the bow tie, start thinking of what condition do you think is likely occurring? Now, you have to determine that the basic or most important information provided in this whole scenario is that the patient is now with difficulty breathing, and there is continuous vigorous bubbling in the water seal chamber. What does that indicate? So let's go to the possible conditions. So what do you think is the most likely condition that the patient is experiencing? Bleeding, air leak in the drainage system, displacement of the chest tube in the pleural space, and lung has re-expanded. In order to answer this question, you have to have a little bit strong knowledge on chest tube, okay? And for those who are in our membership, I know that there's a video in the membership that talks about chest tubes. Very important to see that, okay? You can read it in the Sanders book, 8th or 9th edition as well. It's very clear, and all you need to do is write down the important things about chest tubes, okay? Anytime we see continuous and vigorous bubbling in the water seal chamber, it indicates an air leak in the drainage system. So that is the condition that is most likely occurring. Not bleeding, because if you remember, the drainage went from 50 to 100, so that wasn't a big change in the output from the chest tube. So no bleeding. The scenario doesn't give you enough information to indicate a displacement of the chest tube. And the lung hasn't re-expanded because there was no information about titling, being less titling or absent titling. And the only information that we had was continuous vigorous bubbling, indicating a air leak. Now, if this is the problem, what is an appropriate nursing action? So let's go to the left side now. Clamp the tubing and determine the location of the problem. Apply pressure to the chest tube in the insertion site. Check for subcutaneous emphysema. Disconnect and submerge the chest tube in a bottle of sterile water and notify the surgeon. I don't know how many of you looked at this and said, this is an emergency. So this is an emergency that not only I need to do something, but I need to notify the healthcare provider. I need to notify the surgeon. So answer, notify the surgeon, it is an appropriate action. Now, we have clamp the tubing and determine the location of the problem. Apply pressure to the chest tube insertion site. Check for subcutaneous emphysema. That is an appropriate action. Disconnect and submerge the chest tube in a bottle of sterile water. What do you think is the answer? The other answer. We're missing one. What would you do? I see some selecting 4. Is there any information that it said that the chest tube was disconnected? Any information that said that? There was an air leak, but it doesn't say that it was disconnected. And the tube, the drainage went from 50 to 100. So there is drainage. So disconnecting and submerging the chest tube into the bottle of sterile water doesn't make sense. So this one I can eliminate. Now, checking for subcutaneous emphysema would be a good action. But what is the priority in this scenario? After we call the doctor is the only one that can give us the order to clamp the tubing. The tubing should not be clamped. It's not a decision the nurse makes. But after calling the doctor is the one that can give you the order to clamp the tubing. And if that order is made, is the priority. So the correct answer after calling the surgeon is clamping the tube and finding where is the leak. Because we know the problem already. There is an air leak in the system, in the drainage system. Now we need to find where is the leak. Is it inside the patient? Or is it the tube? Is it the drainage device? Okay? Now, we have two actions to take selected. We have the condition determined. Let's go to the parameters to monitor. What will you monitor in a patient that has an air leak after calling the doctor and clamping the tube? 1, chest x-ray. That's not a nursing intervention, so probably not the answer. Hemoglobin, hematocrit, platelets, red blood cells. If there was bleeding or any indication of bleeding, hypotension, maybe, but not the priority. Now, I'm dealing with a respiratory device, a respiratory problem. So what do you think about monitoring vital signs such as heart rate, BP, respiratory rate, and SpO2? Fluctuation and bubbling in the water seal chamber. We noticed that the problem was the air leak. We noticed that there was vigorous and continuous bubbling in the water seal chamber. So monitoring that told us that we had a problem. So do you think it's important to continue to monitor for fluctuation and bubbling in the water seal chamber? I will be doing an assessment to that tube, which is the problem identified on the case study or the clinical scenario. Drainage amount in the collection chamber, yes, that is important, but that is not the priority course of action. So I will eliminate chest x-ray and drainage. How do you do on this one? This was a more difficult question than the one before. So if you did at least 3 out of 5, I'm happy with that. How was your answers? 5 out of 5, 4 out of 5, 3 out of 5, 2 out of 5, 1 out of 5. How do you do? Three out of 5, not bad. 4 out of 5, 5 out of 5, good job. Three out of 5, difficult. No, it doesn't matter if you selected the condition wrong and you got the other right. You still get points. That is what is good about this type of questions. That's why I like them. I think you guys are ready for this next generation NCLEX. I think we're going to have a lot of pass for the next generation NCLEX. Yes, I know that. I know that this 7-day training will be very beneficial to any nurse in the future taking the Next Generation NCLEX starting April 1st, 2023. So no reason to be afraid anymore. Now you know what to expect. Now you know what's going to be on that future exam. And you know that you have what it takes to pass the NCLEX. All you have to do now is keep studying, keep reading, keep practicing questions, practice more of these questions when it gets closer to the Next Generation NCLEX, and go get that license that is yours and it has your name on it. That's what I believe. That is what I pray for, that God gives me the right words to communicate here and to teach you the right things for you to become a registered nurse in the U.S. All right, so let's go to the candidates that we will be selecting today. Remember that anyone that I mentioned today will receive free access for 3 months to our NCLEX Crusade International membership. Here's the chest tube. Remember I told you that it was chest tube in the membership. So if you want to learn about prioritization, arterial blood gases, chest tube, infection control, EKG interpretation, dosage calculation, safety, management of care, psychosocial integrity, many practice classes, a lot of practice questions with video rationales. This is the membership for you. And if you're one of the lucky persons, I will be mentioning your name very soon. Remember that also with the membership, I will include about 2 live classes per month on Zoom where you can interact, ask questions, participate. And that's pretty much it for today, guys. Let me select the 3 candidates. So the first one that is going to be the winner in our raffle is, we have Teresita Junon from the Philippines. So congratulations, Teresita. A lot of people from the Philippines in the raffle. Welcome to NCLEX Crusade International membership, Teresita. Let's do another one. The second one is, ta-da! Let me see, Adeyemi Christina from Nigeria. Welcome, Adeyemi, to NCLEX Crusade International membership. All right, the third one. Stephanie Rayan Fernandez from the Philippines as well. All right. All right, guys. So I'll see you tomorrow in our day 6. Wow. 2 more days of live training. Tomorrow's questions are going to be awesome. I am sure of that. We will be discussing some very interesting strategies for you to continue learning and improving. Thank you for being here. Thank you for trusting us. And I really hope that this training has been a blessing. I saw some of you asking about the membership. The membership is very inexpensive. You can either pay, there's 2 options, $19.97 per month, and you can cancel anytime. You have to cancel it. You have to notify the academy to cancel it, but you can cancel it anytime. Or you can pre-purchase for 3 months and you will save 50% of the payment to help you a little bit more. But like I said, I have created a membership that is very inexpensive for most of you out there. But I know that some of you are in countries that maybe $19 or $20 is too much. And that's why I try to give some free membership and try to help out the community and the nurses out there. Thank you, guys. Thank you for being here. God bless you all. God bless your family. See you tomorrow in day